I'm Iona Heath. I was a GP, a general practitioner, in London in the same practice for nearly 34 years. And then from 2009 till 3 weeks ago, I've been president of the Royal College of General Practitioners in the UK. General practice is the foundation of a cost-effective, socially fair health system. Because without a very strong system of primary care, including primary care medicine, patients will tend to move into secondary care, into specialist care. It's more expensive, it's more dangerous, and they do very little of this trying to hold people back from labels because they work entirely in labels. And there's now a massive amount of evidence that the stronger your system of primary medical care, you get better health outcomes for less cost and less health inequality. That's a pretty good argument. I think that general practitioners do have to have a calm character because they need to cope with a massive amount of uncertainty. The fit between the classification of disease and what patients actually come through the door complaining of is not a good one. So you're always thinking, does this person have this, or it doesn't quite fit, and would it be useful to give them this label, or would it not be useful? So you're constantly having to balance probabilities, and the prime thing is to think, for this particular person at this particular moment, would this disease label help them, or would it be just better to keep them having what we call an illness rather than a disease, just having a few symptoms and seeing what happens next week, rather than rush to give them a label and everything that follows on from that. It's called The Art of Doing Nothing, and it's about the importance of doctors not rushing to doing. Medicine is a very activist profession. You are judged by what you do. What I'm arguing is for the importance of listening, of thinking, of just being there, of actively preventing harm by not doing very quickly. So I'm going to sort of try and cover those sorts of areas. The general practitioners in Great Britain, I suspect, are more established, certainly in academic terms, because we have had academic departments of general practice. We now have them in every medical school across the country, and really general practice has been crucial to the health service since 1948. And we tend to work in bigger practices now. I think that there are many Hausarztmedizin doctors here who work in very small groups or on their own. So we tend to work in bigger groups, and we tend to work in teams with nurses and social workers and other professionals. Both have strengths and weaknesses. I think the great strength of the very small practice system that I think you have here is that you have real continuity of care, whereas continuity of care is very easily eroded in a system where practices get bigger.